Hello, I'm Salome Tibabu, the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Oleg Tarkovsky here, Director of Behavioral Health at CareFirst. Welcome, Oleg.
Hi, Salome. Thank you for having me today.
So can you start off by giving the audience a brief background about yourself?
Sure. I have joined CareFirst just over a year ago, just a couple of months before we all got shut down in our homes as a result of COVID-19 pandemic. And I've been here ever since and sort of thrown to the deep end of the pool almost right away, trying to help millions of members deal with the inevitable consequences of the pandemic. Prior to CareFirst, I was the Division Director of Outpatient Services at a community organization called Mosaic Community Services, which is affiliated with a large health system called Shepherd Pratt Health System here in Baltimore, Maryland. I was there for about 15 years, progressively moving my way through the various ranks of initially running a single clinic to eventually running a number of clinics, providing outpatient behavioral health services in the Baltimore metro region. I also teach part-time at a Towson University here in Baltimore County. I've been an adjunct professor of psychology here for about 15 years now. I love teaching students about psychology, about counseling, and sort of giving them a perspective into what to expect once they graduate and become social workers, counselors, or psychologists. I have a small private practice here in Baltimore. I am a father. I have an almost 12-year-old here at home. I love to run. I probably run almost every day, sometimes more, sometimes less. I practice meditation, mostly mindful meditation daily, and I would encourage everyone to try. I love to travel. Definitely has been difficult on all of us, but hopefully as restrictions lift, we'll all be able to get back to our traveling days. Let's see, what else? I love figuring out what makes people tick. I got into this business, I believe, for that reason almost 20 years ago, and are still staying here for the same reasons. Almost every new person I meet, in a way, presents a new opportunity to learn something. And so I'm very happy to be here with you today.
Thanks so much, and excited to share your expertise with the audience. And so CareFirst serves Maryland, DC, portions of Virginia. Can you talk a little bit about your member population and what plans you offer?
Sure. So CareFirst has been around for over 80 years. We are an independent licensee of the Blue Cross Blue Shield Association. We are the largest commercial health plan in the Mid-Atlantic region with over 3 million members, probably around 3.5 million members now. We offer HMO and PPO commercial plans, as well as Medicare and Medicaid plans. We also have recently started to get into the EGWP business, as well as offering federal employee programs. We have over 500,000 of FEP members in this region, being that it covers the DC, Virginia area.
Yeah.
But we are a national plan, meaning that even though the service region is the DMV, we have many members living around the country that we serve day in and day out.
Great, thanks so much. So you and I have talked about this before. Digital behavioral health solutions. What do you think about them?
Ooh, where do we start? So digital anything solutions have been around for a good bit of the last couple of decades now. And as folks begin to use some of those solutions, often the promises don't deliver fully. And so we shouldn't be surprised that in this area, the results would be any different. So when we evaluate digital solutions of any kind for behavioral health, I usually try to answer a couple of questions. First one being, what is it that we're solving for? Are we trying to make things easier for people? And if the answer is yes, then there's a very specific range where those solutions can become useful. On the other hand, if we're trying to solve what is currently unsolvable or difficult to solve within the human realm of solutions, then I begin to immediately question the veracity of those promises. So for example, it's probably to no one's surprise that we nationally have a shortage of licensed, trained behavioral health providers. And so a lot of the technological promises have been made to solve for that problem. Well, as a licensed psychotherapist myself, I could tell you that right now, there is no technology that exists that can replace me. And if there was, I'd be the first one to tell you. And so if an individual needs a therapist and the solution to that need is some kind of a technological solution, it will almost by definition not be as good as me. I've had years of education and training to get me to be the best I can be for my patients. In order to do that, most of the research suggests that the main element that drives this ability to influence one's emotional well-being is the relationship itself. And so it's not really that important whether you use a cognitive behavioral therapy approach or behavioral therapy approach or analytic approach or solution-focused approach. It's the relationship itself. And therefore, unless someone has a technology that is able to recreate that relationship, most digital solutions fall short of actually solving our shortage of trained behavioral health provider problem. So then what is the next best thing? Well, now then we pivot to the making things easier solution. And yet again, there are certain things where making things easier could be of benefit, similar to other areas of our lives. So think of physical health, for example, and the need to exercise. And so we may have a smartwatch that helps us monitor our activity, or a calendar reminder to go for a run in the morning, or some kind of a behavior modification system that rewards us for doing the right thing. Unfortunately, all of these things simply exist as a supplement to our already inherent desire to do better, to be better, to function in some way differently. People struggling with behavioral health needs need something more than that. That is typically not enough, because if it was, there wouldn't be such a need to solve for this problem. And so that brings us back to your initial question: digital behavioral health solutions. I think at best, what we could learn from the existing technology is that most of it could one day be a small part of a larger solution. So for example, in my role here at CareFirst as a director of behavioral health services, I often get approached by companies from all over the country and sometimes the world at pitching their ideas for technological solutions for various problems our members may have. And in my role in behavioral health, they're usually behavioral health focused. And so For example, there are some solutions out there that can help diagnose depression and anxiety by simply listening to the tone of your voice and sometimes the content or the words within your speech. Okay, that sounds like a novel solution, interesting. Is it as good as taking a 9-question PHQ-9 assessment? Maybe, but we already have the PHQ-9. And so if I wanted to know if somebody is exhibiting symptoms of depression, I would just have them do a PHQ-9. And so this is an example of this redundancy that is currently being created by digital behavioral health solutions. And so again, in my opinion, if we can just take the paper and pencil versions of the assessments and convert them into a digital, easy to do, quick, confidential from your cell phone delivery methodology, that could solve for that problem.
So we've got a lot of digital behavioral health startups in the audience today. In light of everything you're saying, it sounds like they've got to have something that's really novel and above and beyond what's already available at the health plan. Can you talk a little bit about what they should be thinking about? How should they approach improving outcomes and decreasing costs and proving those out?
Yeah, absolutely. I'm being asked this question often. And as a behavioral health provider myself, one of the concepts here is the idea of continuity or longitudinal results. And so often any decent technology, including digital behavioral health technology, can give us some results sometimes. And often those results, if achieved, are demonstrable in the initial rollout of the solution. The bigger question I have, and most health plans probably do as well, is what happens 6 months from now? What happens 12 months from now? And again, I'll use the analogy to the physical health. We thought a few years ago that, for example, incentivizing folks to use gyms was going to significantly improve the physical health of our membership, which it does, only if they're actually going to the gyms. And so, as most people know, the gym memberships skyrocket in January and usually fizzle out by March, April. Well, the same idea exists within the behavioral health world. A lot of these solutions, even if great at first and novel and exciting and engaging, people just simply get bored with it or get tired, or it's maybe the other way around. It's not challenging enough. And so they stop using them. But the true and the wisdom of this question lies in doing something that will benefit you for a long period of time. And so to do that, what is typically necessary is a mind shift. And a mind shift, again, not just in your way of thinking, but usually in the way of doing. And so humans are creatures of habit. And so in order to achieve anything that will last, we have to change our habits. And to change the habits, not just a little bit, but significantly. And to do that, what typically is required is to do things that are hard. And hence the saying, doing the hard thing when it's the right thing to do. I'm pilfering this from Robert Sapolsky a little bit. But again, it's the action that matters most. We often talk about awareness, for example, awareness of mental illness and the stigma that the lack of awareness brings. I think as a result of the pandemic and the concept of mental health and mental illness being in the news, in the 24-hour news cycle these days, you'll be hard pressed to find anyone who's not aware of mental health challenges. And so now we have to move on. We have to go to the next step, which is action. It's not enough to just talk about it. We actually have to do something about it. And again, often when we talk about it in third person. Someone else should do something about it. Well, the truth is it starts with us. Each one of us has to do something about it, which is doing those hard things that are the right thing to do. And there's lots of things all of us can do to help ourselves improve our mental health. And if someone does have a diagnosable mental illness, we should do a much better job as a society to provide the available treatments those folks need. Do it quickly and do it to the degree we currently do with medical treatments, without stigma and without difficulties or challenges in getting that help, and not finding life hacks or tricks to kind of band-aid the issue without actually delivering the treatment that the individuals need.
Yeah, barriers to start a behavioral health tech startups have certainly reduced, but still challenging issues to actually deliver on. Yeah, really interesting. So we've also talked about this a bit before, but can you talk a little bit about mental health versus mental wellness, especially in the context of developing solutions to address each?
Sure, absolutely. So actually mental health and mental wellness are kind of one of the same, but they're very different from mental illness. A good way to think about these things is to start looking at a 3D model versus a 2D model. So in most people's minds, the mental health and mental illness are two ends of the same spectrum. You have mental illness on one side, mental health on the other. Well, that's not exactly accurate. So instead of looking at it on a single spectrum, we got to look at it on a three-dimensional quadrant spectrum. So you have your mental illness on one axis and you have your mental health on the other, meaning that at any given point, you can have an individual in any one of those quadrants or somewhere in between. So you can have a diagnosable mental illness and yet be mentally healthy. And at the same time, you can have poor mental health and not have a mental illness. And so that's kind of the foundation of the principle. Two different problems, two very different solutions. So on the mental illness side, we have all sorts of solutions, anywhere from, for example, timely diagnosis. As we know, most mental illnesses are developmental progressive disorders. So the sooner you can diagnose and start treating, the better off the prognosis for that individual are. And we have treatments. Most people probably don't know this, but for major mental disorders, such as depression, anxiety, substance use disorders, we have great treatments out there, including counseling and medication-assisted treatment. And what, again, most people probably don't know is that the success rates, if properly adhered to, of the treatments of mental disorders is greater than that of diabetes and hypertension, if folks just comply and use the treatment properly. On the other hand, we also have lots of ways in which we can improve our mental health. And this is probably the part that's a lot less talked about in the media because it's not sexy, it's not this hot topic that everyone wants to find a solution for, because it's actually rather boring. Sleep. We have to find a way to get to better sleep. A huge amount of repair in our brain, the organ that produces the mind, which is us on this Zoom call, happens while we sleep. Approximately 6 to 8 hours of our day, every day for the rest of our lives. And yet, most Americans would probably say they don't get enough sleep. Same could be said for healthy diet and some regular form of exercise. Those three things combined, some of the latest Harvard studies have shown, if done, all three of these things combined, will have similar results to modern psychotropic medications to address symptoms of depression and anxiety. So that's your mental health side. And they also serve in a preventive way. So this is where probably would be a good time to introduce the concept of resilience. Resilience is a form of mental health. And again, contrary to popular belief, resilience does not mean you're the superhero and no matter what amount of stress comes at you, you're like a wall, letting it all bounce off of you. Quite the opposite. Resilience is actually sort of riding the wave of stresses of life and letting it knock you down, but then get back up again and just keep doing it over and over again. And even if the knockdowns are frequent, you're able to rise back up again. And that's how one builds their mental health. Over time, these patterns of behavior now become the new healthy habits. And that kind of brings us full circle to the habit loop, which is just like with physical habits, there are great sets of mental habits. I think it's ironic that we're talking about technology because in many ways, technology over the last couple of decades has been the Achilles heel in most people's mental health. Again, not the illness side, but mental health for all sorts of reasons. Anywhere from sort of this escapism that typically folks find in any distracting stimuli, all the way to full-blown addiction, whatever the technology of choice is. And some research recently has demonstrated that the power with which the addiction to technology grips us is no less than substance use and abuse. And so we really have to be careful. I kind of divide this whole paradigm into two sides. The technology, especially social media-based technology, often promise us that this dream of connection, when in fact, what it really does is simply gives us a way to contact one another at the price of the connection. Because connection, especially human one-to-one connection, lies in the deeper levels outside of pictures, outside of one-liners. And that technology has taken away from us, in some ways by design and others as a side effect. And so again, I often think, what would some of these technologically based behavioral health solutions do in the long run when it comes to replacing these deep, meaningful connections with one another with these quick contact-based connections? And again, there's plenty of publicly, commercially available products out there that do just that, whether it's text-based or otherwise. And again, I worry that it's at the sacrifice of true, meaningful person-to-person connections. I say all this not to discourage people, but just the opposite. This is a challenge. I think technology is here with us to stay, no matter what anyone says. And so the question is not why not, but how can we find a way? And I'm sure there is a way. I just haven't seen it yet that offers this complete way of sort of supporting the existing models for treating mental illnesses. There's definitely technologies that help promote mental health. That's for sure. And so anyone that can hone in on that and improve, for example, this habit loop concept within the technology. So not something that I hop on for a few minutes here and there, and then maybe within just a couple of weeks stop using altogether, but keep our interest peaked during much longer periods of time. Because again, a lot of these concepts are deeply rooted in our biology. And this is what, again, unfortunately, a lot of tech companies don't either know or understand, or don't have the advice consultants around them to explain to them. Because, for example, the hedonic adaptation concept, are you familiar with that?
For those of us in the audience, please share a little more.
Okay, so it works pretty much with most emotions, but just for the demonstration, let's just take happy and sad. So happy and sad results when our circumstances, usually immediate circumstances, do not align with our expectations. In the happy side, they don't align with our expectation in a negative way. So something happens, we think about that event, and we think to ourselves, nothing bad happened, therefore happy. On the sad side, we expect things to be good, something bad happened, sad. This is almost like a grade school explanation. The next level is, well, how can we accentuate the happy and diminish the sad? And so, for example, you might go buy a new pair of jeans, and that might make you less sad, more happy. Or maybe you buy a new car, or maybe you quit a job and go get a new one. All these are different ways to kind of change our immediate circumstances, to change this relationship between expectation and what happens as a result of it. Here comes the punchline. Unfortunately, or fortunately, our brains, through millions of years of evolution, have learned how to restore us back to status quo. And so whether you just bought this thing that you've really been wanting to get for a long time and you got it finally, or COVID hit and now you're locked in your house for 9 months, it doesn't really matter, because what the hedonic adaptation concept says is within a relatively short period of time, the level of our happiness or sadness comes back to about the same level. And so whether you buy more stuff, or you get rid of stuff, or you get hit with sort of predictable, usually negative circumstance, you end up in the same place just a little bit later. To demonstrate this point, Dan Gilbert, a Harvard clinical psychologist, experimental psychologist, has done experiments when he talked or interviewed folks that won a lottery of $1 million or more. And then as his control group, he talked to paraplegics that lost multiple limbs as a result of usually an accident of some kind. And so he, as predicted, sort of assessed their level of happiness in the moment when the initial incident occurred. So shortly after winning a lottery and shortly after losing both of your legs. And not to anyone's surprise, the lottery winners were very happy and the paraplegics were not so happy. He came back 12 months later to interview the same people to see how they're doing a year later. Guess what? Their level of happiness was about the same as compared to one another 12 months later. The lottery winners were not as happy as they were 12 months ago when they just won the lottery, and the paraplegic were not as sad as they were when they just lost their legs. And so the hedonic adaptation concept in full action there for you. And so the reason I mention this idea is because a lot of the technological solutions for our behavioral health needs today are promising you this infinite improvement process, when in fact, that goes against our human biology.
speaking of behavioral health solutions, clearly you've thought a lot about this. What is it that CareFirst is doing for behavioral, especially as it relates to digital?
Yeah, that's a great question. So CareFirst has four major branches within our behavioral health services. The first one is a triaging service available to all of our members 24/7. So on the back of every member's card, there are multiple 800 numbers. And usually the fourth one down is our mental health and substance abuse number. We have operators waiting to pick up that call 24/7. And then during regular business hours, those calls are routed to our behavioral health care management team, which helps our members assess their needs and then triage it to whichever source of support they require, anywhere from connecting them with a provider to getting them into maybe a higher intensity level service like residential treatment or intensive outpatient, or getting them to the right residential or inpatient facility if that's the level of need they have. The same team also offers behavioral healthcare management services. If an individual's needs are multiple or fairly severe, we can manage them for up to 6 months if they need that level of support. So that's the first component. The second component is our behavioral healthcare transitions of care team. So anytime a CareFirst member ends up in a facility like an inpatient hospital or residential treatment facility, our TOC team follows that member first during their stay at that facility, and then shortly upon discharge, making sure that they have the right services in place, making sure that they have outpatient follow-up, making sure they have access to medication, addressing any of their social determinants needs. It's again, this wraparound approach to making sure that our members have everything they need to succeed after leaving the facility. The third component is our substance use disorder program. I love this program. It kind of hinges on the latest science we have, which is the fact that 95% of the population does not need to go to a locked door residential treatment facility to address their substance use needs. It focuses on using a concept called IOP, intensive outpatient programming. And we've partnered with 13 local area providers that are excellent at intensive outpatient treatment. They use the latest counseling and medication-assisted treatment protocols, and we're able to assist our members to get into those programs. So that's the first part of that program. The second part of the program is because we know that sometimes finances can stand in the way in getting into such intensive level programming because of their copay requirements, we have a cost share waiver applied to that program. And so if a member goes into one of these 13 partner programs, they no longer have to pay their copays, which is really beneficial given the fact that sometimes in IOP, members go in 3 times a week for 3 hours a day, and sometimes for 8 to 12 weeks. So if they did have even a $10 or $20 copay, that could add up very quickly. And then finally, the fourth component of behavioral health services is our future digital behavioral health platform. Currently, our members can search for a behavioral health provider right on our member-facing website. Soon, though, we will incorporate a digital behavioral health platform specific for behavioral health care needs. The platform will allow every one of our members to assess themselves using a self-assessment screening form for stress, for anxiety, for depression, for PTSD, you name it. If there's an assessment out there, they'll be able to do it right on the platform. The results of the assessment will then garner a recommendation for treatment. And it could either be back to that mental health, mental illness continuum. It will either be a recommendation for self-help, through our mental health and wellness improvement pathways, from digital CBT to mindfulness relaxation exercises and so on. Or if the level of severity rises above that, so moderate to severe, they will be redirected to our in-network list of providers, which will be searchable by their specialty, by their demographics, by their region, and or by availability of their telebehavioral health services. I know you haven't asked me this question yet, but this is probably the biggest change we have experienced both on a national level as well as at CareFirst. So maybe just a couple of weeks into the pandemic, so we're talking last March or April, a lot of our behavioral health providers out there on the ground, just like many other businesses, have shuttered their doors and have not returned back to their offices. But unlike many businesses, they were able to quickly pivot and provide services via telehealth. We saw a 4,000% increase in the telebehavioral health services at CareFirst since last March. And so as a care plan, we've adapted quickly. We were able to pay our providers to do so online, and we're able to quickly connect our members with telebehavioral health providers that matched well with their needs. And that was probably the biggest change in our business. And I think this will be one of those semi-permanent changes moving forward.
That is so exciting. Thank you for giving us a sneak peek into that. And if I could ask you one more question on this note, what are you most excited about the future of behavioral health?
Yeah, so that's a great question. Again, I'm being asked this question a lot. What I'm excited about is that I hope as a result of the pandemic, and this is one of those silver linings, if there are any, lots of folks are very much aware of the issues surrounding mental health and mental illness. For the longest time, we've been doing awareness campaigns. We've been trying to get people to talk more about mental illness. Well, I think the cat's out of the bag. I think anyone that has a screen anywhere within an eyesight has seen something and has heard something about mental health and mental illness. I think now we have to act. We have to do something about what we know is, in some ways, is inequity. So for example, being able to access certain behavioral health services is now very much driven by what insurance you have, what zip code you live in, sometimes what color skin you have. And so all of those inequities have to be solved for. There's no more excuses. And then at the same time, we also know that there are science-based methods and treatments that can help people. Again, no excuse saying, oh, well, therapy doesn't work, medications don't work. They do. If an individual has a mental health diagnosis, there are lots of treatments that work very well. Finally, back to the technology concept, there are lots of technologies that I've seen and many more that are coming out every day that will be adjunct to the existing face-to-face therapy that you can get from a clinician. As a therapist myself, I often say that the real work happens in between sessions. I only have most patients for about 45, 50 minutes once a week. Well, there's a lot more minutes and hours in that week for the individual to work on their issues on. And so if there is a technology that can help them do that, that will be of great benefit. digital journals, for example, or wearables that can help people track their moods and their thoughts. Again, a lot of basic behavioral health is based in these, what I call the brick and mortar of what makes us human. We all perceive, we all sense, then we perceive, then we think, then we feel, then we behave. There's your chain. And so anything that can affect that chain, hopefully for the better, and technology is one of the elements that can help us, I think is the future of behavioral health. Because I don't think there's going backwards. So from, just to digress for a second, our most basic kind of social, evolutionarily driven relational activity is being with one another. And that is key to our overall well-being. There's been lots of studies looking at people that have been deprived of that socialization, whether it's examining the behaviors of prisoner of war survivors or folks in jails and prisons put in isolation. We know that simply not being able to interact with other human beings significantly diminishes our ability to function. And so if we can find ways, even with technology's assistance, to interact with one another in more meaningful ways, that will significantly improve the overall behavioral health of our populations.
Yes, totally agree. Really important insights. Thank you so much, Oleg, for sharing your expertise with us today. Really appreciate it.
My pleasure. Thank you, Salome, for having me.